Hello, my name is Carl Cooper, and I'm the Project Manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability, and this is our presentation, Health Insurance Jeopardy! Part 4, Medicaid Eligibility. For those of you unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it's the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. And I always say that when a consumer is looking at plans on the ACA marketplace, it's like playing a game of Health Insurance Jeopardy! And I say that because those of you familiar with the game show know that in Jeopardy! It's not about the answer, it's about asking the right questions. And consumers need to make sure they are asking the right questions about the plans being offered in order to make an informed choice. So let's go ahead and play our game. And today we're going to be looking at the category Medicaid eligibility. And I should state off from the very beginning that we are not Medicaid experts, or I am not a Medicaid expert, I should say. And Medicaid changes very much from state to state, as every state plan is different. So what we want to cover in this category is just some broad issues that sometimes come up with Medicaid eligibility and how it is determined for individuals that you might be meeting with. So when you're completing the enrollment on the exchange, you're going to arrive at a question that about disability and whether the individual has a disability. In this instance, you want to ask the question, does the individual want to apply for Medicaid? And the reason that is, if the individual answers that she does have a condition which limits her activity, then what happens to the application and how are they determined whether they are Medicaid eligible? And in this instance, if you answer affirmative on that, it sends you for a review for Medicaid, a Medicaid determination. And in some situations, in some states, you're going to know that the person, because of their income or whatever, is not going to qualify for Medicaid. So you may not want to answer that question yes, because it could then hold up their application and moving forward in getting that individual coverage. So if the individual has cerebral palsy and it affects her ability to walk, talk, and breathe, then you need to ask the question, is she medically frail? And medically frail is a special term put forth in the Affordable Care Act that gave states the ability to define what that term is, and then as we see, develop a set of benefits for those individuals. So medically frail will be a specific term that's defined by your state, and it's going to mean different things in different states, so it's not going to have one overarching definition. So if you determine that the individual does qualify as medically frail, then you want to ask the question whether your state offers an alternative benefit plan for the medically frail. And the alternative benefit plan is just that. There is the separate traditional Medicaid, and then there's also an alternative benefit plan under Medicaid that the medically frail can then access. And it might have a very different set of benefits that would be available to that individual and what would be covered for that individual. So you would want to take a look at that. So then, if the individual does qualify as medically frail and your state does have an alternative benefit plan for that category of individuals, then the question you need to ask is, should the individual enroll in the alternative benefit plan or traditional Medicaid? And this is going to be very similar to comparing insurance plans as you would for someone looking at private insurance. You're going to want to look at what's offered, what the individual needs, and which is going to be the best fit for that individual. So in that instance, it's going to be very similar, and it's going to be the same sort of thing that you're doing, because just because the person does qualify for the alternative benefit plan does not necessarily mean that that's going to be the best selection for that individual. If you're interested in finding out more about the NDNRC, you can check out our website, which is www.nationaldisabilitynavigator.org. You can also find my contact information on this slide. Feel free to reach out to us if you have questions as you're assisting an individual with a disability enroll in health insurance. Also, please subscribe to our YouTube channel to get more helpful videos like this one. And if you're interested in learning about the other categories listed, be sure to check out the links in the description below to access those videos. Thank you.